All right, welcome back. We've got a special guest in studio. It's the president and CEO of Barton, Clint Purvance. Thanks for taking the time to join us.
Yeah, pleasure. Thanks for having me.
A lot going on with Barton, right?
There
Big move
is.
right at the state line area.
Yes.
So why is the hospital moving, or why are parts of the hospital moving?
Yeah, it's a great question. You know, we've been a bi-state healthcare system for many years, serving a bi-state community. And so we have resources to meet the community needs on our California campus, where the hospital is today, and on our state line campus, more outpatient ambulatory services. But as the needs of the community change, and as our infrastructure ages, and we have some 60-plus-year-old buildings, we have to replace those. Right. We have to build new, we have to expand programs, and we need to do that in short order in the next 5 to 7 years. And then we need to find land to do that on. So we do have extra land to build resources for the community's health on our state line campus, where our California campus is built out. And so we don't have building opportunities for an expansion or growth or replacement of aging infrastructure on that campus.
Let's talk about that California campus. What happens when you do part of the move?
Yeah, so you know, some of that infrastructure on the California campus does have to be replaced. It doesn't meet seismic requirements that are coming in 2030 in California. But there's a lot of pieces that have only been there for 30 years or 10 years, or we're rebuilding our community health center this next year and expanding that, doubling that in size. And so there'll still be a lot of useful infrastructure for the service of the community on the California campus today and into the future for generations. And a lot of that'll be outpatient clinics, ambulatory systems of care, where the majority of our care is delivered from the health system standpoint.
We're lucky in a community of this size to have the resources that we do. When can people expect the move to start taking place, and when's completion slated for?
Yeah, so you'll start to see even more development on the two-campus model over the course of the next several years, with more outpatient clinic offerings both in California and Nevada. But the hospital is a big replacement project. That's measured in many years. And so I would anticipate over the next 1 to 2 years, we'll focus a lot on building the right-sized hospital, making sure we have the planning in order with the local governments, and that business model is fully evaluated by our board, and then we're off into a project. The building cycle's about 3 years. So ideally by 2030, we would have a new state-of-the-art hospital for our community.
All right, so people want more information. What's the best resource?
bartonhealth.org/dual campus. If you go there, we have a ton of questions that we're answering for our community and what it means to receive care in the two-campus model, and please check us out.
Pretty exciting what you're doing here for the South Shore, and good luck with the transition.
Thank you so much, Pete. Appreciate you having us.
All right, he's president and the CEO of Barton Health. Get a chance, go online, look at the timeline. It's going to be awesome. All right, stay tuned. We're heading back to the studio.